Hi, this is Dr. Santucci. One of the things that we're looking at when we're doing regenerative medicine is what are the other things that can affect a condition. So especially when we're dealing with congenital or idiopathic conditions, there's always a lifestyle component. We're here with our good friend Peter, and Peter had a really serious, life-altering manifestation of eczema. He was told by his internal medicine doctors that it was incurable and that there was nothing he could do. The very first thing that we did is we ran a series of tests. And the thing about testing is that testing is going to turn into treatment plans. So yes, we did a 2 cc IV injection of umbilical cord stem cells with added exosomes, which made a basic change in the autoimmune capabilities. So that was the part that we did. But the equally impressive part is the part that Peter did. So we tested his digestion tract, and so we come in and we said, oh, the gut biome is populated with nothing. So the Lactobacillus bifidus E. coli that should have been in place was actually totally not there. So we know that, there are theories on eczema is that it's actually a liver manifestation that is sending impurities to the brain, the blood, and in this case, the skin. And the skin it was untenable. He was itching all the time. It hurt. It was creating neuro problems. It was actually stopping his development as an individual. He really did a great job of grinning and bearing and, trying to get through his life, but it's very different than the person that you're going to see today. So when we did this, there's a cliche that we have. There's a part that we do and there's a part that you do. And in this particular case, he had to come up with really the triggers. And the triggers in this case, we were saying on the food production point of view, was gluten and dairy. So he had to completely change his diet to eliminate those things. And then he had to reflorestate the gut biome. And the gut biome is heavy in today's literature. There's lots of people who think the gut is a second brain and lots of those kind of statements. Peter's manifestation was much, much, much more direct, meaning if the small intestines didn't the stomach didn't detoxify and clear the toxins, then the liver had to actually handle it, and it was too much for his liver. So after he did these changes, we begin to see changes in the gut biome, in the measurable Lactobacillus bifidus and E. coli. The blood work was the same thing. So again, when we're running blood work, we're going to take conventional blood work and we're going to run it past lab ranges and include functional ranges, which are much more specialized and, really a lot more specific in terms of antigen producing problems. So again, we walk into this and we go, oh, we've got to fix thyroid. Oh, we've got to fix anemia. Oh, there is an infection. And oh, by the way, there's a probability of parasites. So again, we're back to the gut here. So when we combine the new neurology with the functional medicine, with the regenerative medicine, you begin to get something that looks like a complete solution. So I'm going to turn you over to Peter now, and Peter really is very impressive of how far he's come and really how much he knows about the subsystems that are affecting his life. One of the things that's really fun for us to see is a person really addressing the things they're responsible for and understanding the drivers. Yes, you're going to see this gorgeous, really attractive young man, and that's a great thing that happened here. But what we have is kind of a person who knows how to deal with their own health and a person who really is in charge. Let's talk a little bit about just your diet and the things that you did in that, and then we'll talk about some of the other treatments.
Yes, so when I first started seeing you, even before we had done testing, you could tell just by looking at the condition of my skin and how bad it was that almost certainly that would require eliminating gluten and dairy. I have enjoyed in the past many foods that have both gluten and dairy in them, but I had just gotten to a point where I felt like I was at a crossroads with regards to my health, and if I didn't do something to take the other path at that moment, it was only, and I both knew it instinctively, and based on what you were telling me, I knew that it was only going to go worse from there. So I made the decision to completely cut those foods out. Since I first saw you on May 29th, I have not had a single instance of gluten or dairy in my diet. and I saw some immediate relief, and over the past few months that has blossomed into a complete change in the condition of my skin versus when I first saw you.
Yeah.
In addition, I have lost about 20 pounds.
Whoa.
I weighed around 180 when I first came in to see you, and now I weigh, it fluctuates from day to day, but it's stabilized in around the 160 range.
Yeah, you look good.
And it's not as if I'm under eating in order to get to that weight. I think what's happened is, as I cut out these foods that were causing an inflammatory reaction, even beyond the obvious in my skin, which was the most obvious and the one that I felt most viscerally on a day-to-day basis.
Right.
A lot of the weight that I've lost is inflammation that I didn't even, it had been there for so long that I didn't even realize it was there.
Yeah, it just robbed you of energy. So fat is still vascularized, even though it doesn't produce anything.
Exactly.
How is energy? What's the deal?
Energy feels great. As part of what was affecting my skin, it was also affecting my sleeping patterns. Before I made the changes in my lifestyle and diet,
Right.
I could not remember the last time where I had had uninterrupted sleep in a night. It had been at a minimum several months, if not more.
Right.
As my skin continued to improve, it was not irritating me as much. I
Right.
found that I was much more able to. Now I have uninterrupted sleep almost every night for the past couple of months, and partly I think as a result of that, partly as a result of not consuming these foods that I have, an adverse genetic reaction to. I feel much more energetic, both physically and mentally. My mind feels a lot. My thoughts have so much more clarity than they did before. I feel probably more mentally active than I have in a long time.
Right, and that's pretty evident. We're seeing that in you also. So, can you talk a little bit about the research you're doing now into the gut biome? Like, what do you think about it all? What's the food changes you've made to kind of get the fermented foods, and what else are you doing?
So in addition to cutting out gluten and dairy, as well as we found soy and eggs that I have a lesser sensitivity to.
Right. We actually tested the secretory IgA, so
Yes.
we know those numbers. Yeah.
So I have, one of the test results that we found was that I had a deficiency of positive gut bacteria.
Right.
So in order to stimulate that, I've been taking probiotics, prebiotics, and then looking and, on my own, as Dr. Santucci has talked about, I have started to, research the different options that are out there. I've tried a couple of different probiotics and prebiotics. I haven't been at this for quite as long. I believe it's been about a month since I saw you last when we talked about this.
Right.
But I have already noticed an improvement in digestion.
Nice.
Through doing this. And then beyond taking in tablet or pill form probiotics, I am taking different eating different probiotic foods. I was starting to eat sauerkraut already, but have started to have that more regularly in my diet. My go-to breakfast since making my initial changes in diet was a smoothie that I have now modified to incorporate to take out some things that we want to avoid, such as mint, and incorporate beet juice as a base part of the smoothie.
Perfect. So methylation of the liver.
Yes.
So, one of the cliches in functional medicine is that skin problems are never the skin.
Right.
And so we're going to look at the liver with its 800 functions, and the liver, methylation and sulfonication loves beet juice.
Yes.
And so, that's really a perfect thing to do. Let's shift gears a little bit. What was it like after you got the stem cells?
It felt, I think even, in the few days after first making seeing you and making the conscious decision to make these changes, I was already starting to feel a positive reaction. What I would say the stem cells did was it was as if there was sort of this internal engine that had already started to fire, both physically because my body was no longer being supplied with what was essentially poison, but also I think mentally making this decision process starts to rewire your brain. And what I found in the period after having these stem cells was that it was providing extra powerful fuel to an engine that had already started firing, but it just sped it faster along that process.
Right. That's something that we're looking on and beginning to articulate, because what we think is, we know that stem cells are anti-inflammatory, they rebuild tissue, they're anti-apoptotic, they're good for immune response, and which is a big part of this. But what we actually think is they give you more usable energy and more mental energy. Certainly that's what, I feel. Certainly that's what the people in our close group have felt. That's not in the literature anywhere. So one of the things that we're looking at this point is actually saying, and it's hard to quantify it. It's a mitochondrial change, or it's a neurovestibular change, or it's just a frontal lobe change or a processing change. We can't tell exactly which systems are being affected, but you went from a person that was like affected, you were a sick person,
Yes.
to this person, which, if we put your picture on Facebook, you're going to get lots of hits. So, you're a different person now. And,
Yes.
We want to acknowledge, just how important a good diagnostic plan is, how important patient, kind of control is. I like the word control, but the only person who has control is you. And then what a good helper stem cells are.
Yes.
And so in this particular case, we didn't stick the stem cells in your liver.
Right.
We did an IV push, which, put it in your bloodstream and then went everywhere. But it was clear there was an immediate autoimmune modulatory effect. Your skin was better. And then you are a great example of a person who's almost done everything right. And then all of our treatment protocols were pretty spot on. So it doesn't have to happen quite this cleanly in 14 weeks. But, you are a great before and after picture. And so we just want to congratulate you. You did a great job.
Thank you.
Yeah.